Good afternoon, Enid. Mayor Pankinen, talking with you again. Again, we're going to be doing this every day, Monday through Friday, try to give you updates on things as they're happening. We'll have different guests with us every day so that we can explain different parts of what's going on and how it affects the community. First, I want to say I appreciate the compliance during this critical time that I've witnessed throughout the city. I've seen a lot of people doing a lot of things just really smart. Even though we're doing takeout orders and to-go boxes, I see a lot of businesses making sure that there's 10 feet distance between two customers standing in line waiting to get things. It's nothing that we mandated that they do, but it's a smart way to do it, and it's meeting the goals that we have of trying to minimizing that social distance. So I appreciate everything everybody is doing there. Like to encourage people to call ahead and pick everything up possible. I mean, you might have to go get groceries, but you don't have to go in to get groceries. There's a lot of places in town, a lot of our grocery stores that currently offer the phone ahead and pick it up at the door. Minimizing contact with as many people as possible is exactly what we're supposed to do to try to be able to get over that. And it's not just grocery stores, it's pharmacies, it's if you got to go to the bank, go to the drive-through. It's all those kind of things. So wherever you can, if there's a possibility to drive up, use that option. That said, today with me is Chief O'Rourke, our Chief of Police. He's going to answer a few questions, and Dana from our Communications Department. So Dana, would you like to go ahead?
Yes. So you are correct, Mayor, that this has affected everybody. And specifically, how has this pandemic affected the police department?
It's changed quite a bit from our usual procedure. We're in strange times at the moment. We're in territory that we've never had to be in. One of the things I did last week was put out a directive urging the social distancing for the officers to stay away from people that they're interacting with, if possible. Try to not go into other people's houses if it's not necessary. We've done a few things with our records department, which deals with the public, to not pass papers back and forth. So, when people come in and want a copy of an accident report or a copy of a police report, they're just showing their ID, they're saying who they are, we fill out the forms for them, and then we'll pass the papers to them. So we're stopping that interaction. On traffic stops, when officers do stop somebody on traffic, instead of trading the license and registration and insurance back and forth, they can hold it up to the window so they can read it, so they can see it. They can have them hold the license so it can be scanned, and so there's no interaction that way. So we're just trying to stay, away from getting hands-on with the public.
Now, during this time, have you seen a higher level of scams?
No, we have not at this time. That's not to say it's not going to happen. There's people out there that will take advantage of any situation. So could I see that happen in the future? Yes.
Awesome. Now, have you adopted any other safety measures for officers, both like on duty and off duty at home, when they go home?
Well, when they go home, I mean, they can adopt their own safety measures. At work, we have given each officer a disinfectant spray that they can use on their units, and they can use on just basically any surface. Each officer has one. A local pharmacy here recently just gave us, all the officers, some hand sanitizer, which is really a good deal because we were running short on that. All the officers have personal protective equipment, which we call PPE. So they have masks, and they're able to wear them if they want them. They have gloves, nitrile gloves that they can wear when they're handling objects and handling other people. In fact, if an arrest is in fact made, if a person is suspected to have any kind of illness, they can put a mask on them as they're transported. So nothing could be caught that way, and then of course they can disinfect their unit.
Awesome. Now, what can the public do to be protected and also protect the police officers?
Social distance, new word. different times, and it's a whole new word that nobody's ever heard of before, but that's the most important thing. And if you are feeling bad, stay home.
So are the police officers following the same guidelines as the Oklahoma Highway Patrol?
Yes.
They are. Okay. Now, do officers need anything like hand sanitizers or any things of that nature, gloves?
At this point in time, they've been given everything they need.
Okay.
And like I said, the local pharmacy that donated a bunch of hand sanitizer, that was really great of them to do, and we're pretty good with that right now. So no, I think we're fine. But then that said, this situation's so dynamic, I don't know what we might need tomorrow.
Correct. Now, with kids being out of school and the possibility of maybe them walking around or maybe possibly selling things, loitering, what do you advise?
I would say that nobody should be really out walking around or loitering. The mayor his proclamation pretty well stops that. And we did have a few issues this past weekend where people were congregating that we had to go tell them to please disperse.
Okay. And with so many businesses running low on manning and low on hours, will there be an increase in patrol cars?
There is a plan in place, and of course we have to see, this is so dynamic, if my officers start getting sick and support personnel, what that's going to do. We are working on a plan to change our hours of operation, still 24 hours, but that would also up the amount of officers on the street.
Okay.
We could possibly go to a 12-hour shift
All
if
right.
necessary.
12-hour shifts. Now, you do have them separated right now with different shifts. I believe there's 3.
We have 3 shifts in a traffic division.
Okay. All right. Is it okay that I take some online questions? There are some viewers in here that are asking, are laundry mats not included in social distancing? I guess that's a mayor question more than it is.
Well, they're included in the social distancing. They haven't been closed. But hopefully if there's 30 dryers, you don't have 2 people in dryers right next to each other. You spread it out. So we're trying not to close everything. We're trying to be reasonable about that, and if to the degree that we get compliance with everybody, not only with the written rule, but also with the intent of the rules. I'm trying to hold off as much as I can, putting everybody on the list, and relying on people to use their good judgment. So.
Correct. That was the only one on social media that I see here. Do you want to go ahead and move on
Okay.
to those?
A couple of other questions have been coming in, and we get questions not only in this forum while it's going on, but afterwards. It's coming through the website. So I would like to share a couple of questions that came in and the answers that we have. First, there's a rumor that there's a fine for violation. In fact, there is a code that allows for up to a $500 fine if people are not complying with the emergency proclamation. But I think the key to remember here, it's in section 5-3-10 of the city code. But I think the point is we're not trying to collect fines. We're not trying to make any money from anybody. That's not what this is about. What it's about is trying to ensure compliance to keep everybody else safe. So again, yeah, there's provisions there for a fine, but that's not really what we're after.
If we run into violations of that, we're going to encourage them. And what we have been doing is giving them a copy of the ordinance and a copy of the proclamation saying, please disperse, please don't do this. And that's our plan. Like the mayor said, our plan isn't to, God forbid, raise revenue by this. It's to make people aware and to encourage them to comply. So it's going to be on a warning type basis. Now, if we get refusal to a point to disperse or to stop what they're doing, then they have that possibility, the officers do, of writing a citation for $500.
Right. Good?
Yeah.
Okay. Another question we have talks about there's a rumor going around that there's going to be a spray that's available sometime in the near future that people in Enid can use, especially for elderly. I know of no spray that's going to be available in the near term. We've talked with the health department. It's one of those things I sure wish there was some available so that we could use it and pass it out immediately or sell it to everybody immediately, but to my knowledge there is no such product available at this time. Next question. A citizen afraid for family, afraid for husband and family members, and the suggestion is, when are we going to shut everything down? And I think it's a good question, but every closure decision involves balancing risk to the public versus the needs of the public. It's not cut and dry. We can't just all stay home for 24 hours and then it'll be over. It's just not the way the virus works. So what we have to do is walk that tightrope every day, every decision, every business, should it stay open or not. So some of those things she mentioned, this lady in the question mentioned essential personnel. Certainly police, fire, hospital, et cetera, that's going to be, I mean, they have to be there to keep us all protected. But you know, some of those people couldn't go to work if some of the others that are non-essential weren't available. For example, childcare. If you have a husband-wife team and they're both police officers in the same shift, maybe that could be worked around, maybe it couldn't. Maybe one works in a hospital, one's a policeman. But if they have kids, somebody has to watch their kids. And if that's not available, they can't go to work. So it's kind of trying to, you got to take it one step beyond what's mission essential, I guess. So that's part of it. The other point I'd like to make is keeping some needed businesses open actually helps to stop the likelihood of the virus spreading. The example I'll use is if we decided, okay, let's close all the grocery stores. Well, what's going to happen is, as soon as the pantry runs out, or maybe before, people are going to head to Oklahoma City, Tulsa, all the big cities, where they're more likely to contract the virus than they will here. So again, you got to balance the needs of the public here with the safety concerns for the public here.
Yeah.
And it's a tightrope we walk, and we don't walk it just once, we walk it every single day. So every day we take a look at, do we need to tighten things up a little more? Are people complying in this area? Is there businesses that maybe are non-essential, to use the words in the question, that we can consider tightening down that we didn't think about before? All of that's looked at every single day. So that's, but it's a good question. It's just trying to walk that tightrope.
All right, awesome. There is a question on here, and you may want to answer it now or answer it in the second segment. Where is testing being done?
Testing for COVID? It's through the hospitals. I mean, it happens through, I think, the ERs, but they're encouraging people not to report to the ER just if they have a cough that might be related to allergies that are happening this time of year. So we're trying to, what could happen is you go in for mild symptoms that may not have anything to do with it. You don't have a fever, you don't have the other symptoms. If you show up, you might be exposing yourself to the thing you're trying to protect yourself from.
Okay.
So, but yeah, you have to go through an emergency room to be able to get to the kits or have a kit taken. And then, because of kit limitations, they're not going to do everybody. If you don't have enough of the right symptoms and you're not in the right categories, then they're going to try and hold that resource for somebody else that might need it coming in right behind you.
And I feel like these other questions are more directed for you, Mayor.
Okay.
How many tests available in Enid?
How many tests are available? I don't know that question offhand. The health department would probably know that, and we'll probably have them back again. We had them on last week. My intention is maybe to ask them come back once a week to give us an update on where we're at.
Okay. And what about the people who are losing jobs and income over this COVID?
Okay, there is, I've talked to, I've had a couple of businesses, one of them Walmart, that said we're hiring. So if people are looking for work and they can't, their source of employment is not available, there is work available there. So there are businesses in town that are actually hiring, so look around for those kind of signs. If you're looking at the small business perspective of what are we going to do, you know, I can't afford to be closed for 2 months with no income or however long this thing lasts. There are loans available, and I'm not sure what the website is, but we'll put that on our broadcast here. But there's like low interest loans that are already been approved. I think for individuals, there's already been a stimulus that's been put out. I think it's $1,000 per person. Don't know the exact details on that, but again, we'll get that out and put it on.
Okay. And someone asked, are there any confirmed cases in Enid?
No confirmed cases in Enid that I know of, as you know, at the time I walked in. But it's a fluid environment. Could be one in an
Correct.
hour.
And would it be possible for the city to get a coronavirus center together to be able to have, I guess, an easier flow of access, public access to the center if individuals were concerned, I guess?
Okay, for treatment, you think?
Let's see quickly, and it would be easier for everybody to access the center who gets sick. Yes, treatment.
Okay. I think the ER is the right way to do that now. If we get to a point where there's an overwhelming number of people coming up with symptoms that are for it, we have a group of us that get together that includes the 2 hospital administrators. Talked to them this morning. The city manager, me, the 2 hospitals, but several community leaders in different areas. And we talked about that this morning, if we may in fact have to open up something like that. So we're looking into how much would that cost, where would we put it? But the answer for right now is we don't need it right now, but we're looking into that in case it's needed in the future.
Awesome. And another question, have we done any testing in Enid?
Oh yeah, I'm sure the clinics, the hospitals
we
have done
have.
tests in
I
Enid.
believe we have. People that have been placed on self-isolation because they have underlying conditions are having a hard time getting groceries on the online pickup. Is there something we can do?
Huh. On the online pickup. Well, some places actually deliver groceries, other places you can pick them up. And if I know there's at least 2 stores that I can think of. I know Walmart does, you can order them in advance, so does Jumbo's. There's several stores in town, so if one can't meet your need, then I guess I'd call the next one.
And actually, someone just mentioned that there are churches helping with that, so
Good. That's great.
That's
Yep.
great. And are there any pending tests in Garfield County that you know of?
I'm sure there are pending tests in Garfield County because as they're coming up, the tests go in, they take a certain amount of time, like a week or better to get the results back, so I'm sure we have pending.
And do you see the school being out past April the 6th?
It's really a state question, I guess, for State Board of Education. It wouldn't surprise me if they continued to be out past the 6th. I guess they're trying to figure out how to deal with that. So they don't have an easy job right now either.
Okay. And I don't see any more questions online here, so thank
Okay.
you.
I
Thank you
had
for answering those questions. Yeah.
earlier question, I think, that came up, or an issue that came up. People were asking about taking beverages from restaurant bars. And the ABLE Commission came out March 17th with a new rule that said that they could take those out. They have to be sealed. They can't be, you can't take an open container, but you can take them. The other caution I would say is it's kind of silent on the topic, but it doesn't mean that you can go inside, grab a 32-ounce beer, and then you and 20 of your friends sit on the porch outside the bar. That's still congregating. That's still not what we're after. But if you want a beverage to take home with you when you pick up your meal, that's certainly welcome. You're certainly welcome to do that. So that's what that provision really does. It doesn't provide an exception that allows you to go outside instead of in the bar to drink.
And Chief, do you have any other closing thoughts or comments that you want to add?
The only other comment I'd like to make is I've noticed personally traffic is lighter in town. It seems like people are being compliant, they're staying home.
Yep.
as a matter of fact, our call volume is down, which tells me something too. And, you know, Enid's a great community, and I think we're going to be just fine. I think, you know, everybody's going to be compliant. Everybody's going to, you know, is afraid. And so, you know, we'll just get through it.
Yeah, yes, we will.
Okay.
We will.
All right. Thanks, Enid. Appreciate your attention and appreciate your helping us to get through this difficult situation that we're all in. We'll be back again tomorrow at 1:30 for another segment. Make sure you continue to send in your questions. We might not get to them every day, you know, I mean, the next day. If we have to do some research or something, we might hold off and then get it the day after. But I want to give you a complete answer, not a half answer. So, but please keep your questions coming in. Anything we can do to help, just let us know. Thank you.